Hi, everybody. I'm Dr. Ardis, and this is the Dr. Ardis Show. And this entire show is some of the basic but essential nutrients, particularly vitamins, that you need. In fact, the title of this entire presentation and podcast is The Essential Nutrients, What Vitamins You Need. So we're going to dive into a PowerPoint presentation. Remember, anybody watching this, if you like the information that we're highlighting and showcasing here in this show, and you would like to download this PowerPoint presentation and share it with family or loved ones or spouses or children, just simply go to the Dr. Ardis Show and go to the resources tab. And there is a blue box on that page that has titled right in the middle of the blue box, Essential Nutrients, Vitamins You Need. Click that. It's a free downloadable PDF, and you can forward that by email, save it to your computer or iPad or your phone. But send it to those that you think could benefit from the information we're providing you, because this information is life-saving, life-improving, and absolutely essential. All right, so let's dive in. Here's the PowerPoint. You're going to see it on the screen. Let's take you through what it is we need you to know about vitamins and what it is the medical profession wants you to know about vitamins. All right, on the screen, you will see a QR code. This QR code, simply take out your phone, scan it. It allows you to enter you'll see a little window pop up on our website that allows you to put in your email address so you can be notified in the future when our next podcast, which are generally done weekly, are actually ready to be watched, shared with others. So we actually do one show every week at a bare minimum, educating you on the narrative around a health topic and then what we know in nature are the proven in research studies antidotes to many of those complications. All right, so let's first dive into what in the world is a vitamin. There are so many multivitamins around the world and vitamin discussions, but a lot of people don't know the difference between vitamins and minerals. So I decided it was time to just show you a definition of the word vitamin. And it comes from a very reputable source. If you see at the bottom of the screen, it's cancer.gov, which is a government website-owned publication. So if you trust the United States government, you should trust their definitions. Here's what they say about vitamins. Vitamin is a nutrient that the body needs in small amounts to function and stay healthy. Sources of vitamins are plant and animal food products and dietary supplements. Some vitamins are made in the human body from foods that we consume. Well, how does Big Pharma, what do they think about vitamins? How Big Pharma, this is an article from AmericanProgress.org, how Big Pharma reaps profits while hurting everyday Americans. And I would just like to highlight one statement from this article. The pharmaceutical industry leverages Washington's culture of corruption to increase profits while everyday Americans suffer from high drug prices. Well, we're not going to talk about too many drugs here. What we're going to highlight for you is what are the claims of the pharmaceutical industry which leverages the culture of corruption in Washington, D.C. to increase their profits in the context of vitamins. Ready to see it? All right, here's the Atlantic.com. This is a published article titled The Vitamin Myth, Why We Think That We Need Supplements. All right. In this paper, the journalist writes, 7 previous studies had already shown that vitamins increased the risk of cancer and heart disease and shortened lives. In 2012, more than half of all Americans took some form of vitamin supplements. So here, the Atlantic wants you to believe that there are 7 studies that have shown that if you supplement vitamins, you're increasing your risk of cancer and heart disease and a shorter life. The BBC has this published article from 2016 titled, Why Vitamin Pills Don't Work and May Be Bad for You. So this is mainstream media owned by Big Pharma, bringing you their narrative about vitamins, what they want you to believe about vitamins. Well, number one, they wanted you to believe in the first article, they cause cancer and shorten your life. BBC wants you to know that vitamin pills don't work anyway, and they might be bad for you. Well, let's just dive into these myths that Big Pharma wants you to believe. This is Healthline magazine online. You can find this article at healthline.com. They have published, you just read 2 mainstream articles titled that vitamins are bad for you and vitamins increase your risk of cancer, disease, and death and shorten your lifespan. All right, here on healthline.com, this is an article published in 2020. So since those 2 articles I just showed you, or since at least one of them. This is titled The 7 Impressive Ways That Vitamin C Benefits Your Body. Number 1, it may reduce your risk of chronic diseases. Let's read the first highlighted reference here on healthline.com about vitamin C. Vitamin C is a powerful antioxidant that can strengthen your body's natural defenses. That's your immune system. They also published that studies show that consuming more vitamin C in supplement form can increase your blood antioxidant levels by up to 30%. This helps the body's natural defenses fight inflammation, including bacteria, viruses, funguses, and parasites. They also publish here that vitamin C supplementation may help manage high blood pressure. What? Approximately 1/3 of American adults have high blood pressure, they highlight. An animal study found that taking a vitamin C supplement helped relax the blood vessels that carry blood from the heart, which helped reduce blood pressure levels. 29 human studies. I just showed you BBC and The Atlantic highlighting 7 studies. This one's 29. 29 human studies found that taking a vitamin C supplement reduced systolic blood pressure numbers, that's the high number on your blood pressure, by 3.8 points, and diastolic blood pressure was lowered by 1.5 points on average in healthy adults. So if you're looking to improve your overall blood pressure numbers to reduce your risk of heart attacks and strokes, you might want to consider supplementing with vitamin C. There's 29 studies confirming it works. In adults with high blood pressure, vitamin C supplements reduced systolic blood pressure by 4.9 measurements of mercury and diastolic blood pressure by 1.6 on average. Ask your doctor if vitamin C is right for you when they tell you your blood pressure is caused just by your family inherited genetics. Number 6, vitamin C boosts your immune system. First, vitamin C helps encourage the production of white blood cells known as lymphocytes and phagocytes, which help protect the body against infection. Hold up, that's not what those mainstream articles projected to you. They said vitamin C or vitamins were bad for you and can cause cancer and death and shorten your lifespan. Second, they highlight that vitamin C helps these white blood cells function more effectively while protecting them from damage by potentially harmful molecules such as free radicals. Healthline also reports that vitamin C, thirdly, with respects to your immune system, is an essential part of the skin's defense system. It actively transports to the skin where it can act as an antioxidant and help strengthen the skin's barriers. People who have pneumonia tend to have lower vitamin C levels, and vitamin C supplements have been shown to shorten the recovery time. Ask your doctor if vitamin C is right for you. The next thing I want to highlight is not necessarily a vitamin. It is actually an amino acid, and it is called taurine. And I have to highlight this one. It's too important to ignore in this discussion of vitamins. We're going to be discussing a nutrient found in plants and around the world that supply taurine to you, something you may not be familiar with. Healthline magazine states, what is taurine? Benefits, side effects, and more. Did you know taurine, a supplemented amino acid, may fight diabetes, according to Healthline magazine? Taurine's antioxidant and anti-inflammatory properties may enhance insulin sensitivity, thereby reducing the risk of type 2 diabetes or improving blood sugar management in those with the condition. One study found that people with diabetes have a 25% lower concentration of taurine than those without diabetes. Those with diabetes have lower amounts of taurine in their blood. Those who are not diabetics have normal or higher levels. This suggests that taurine might have a role in diabetes management. A 2018 review of studies suggests that the supplements of taurine could be a good therapeutic option for improving blood sugar management in people with diabetes. That is published in medical research studies. Last statement here on diabetics and diabetes and taurine. Taurine could have protective effects against diabetes-related complications such as nerve damage, neuropathy and pain, kidney damage, and heart disease, which every diabetic is confronted with. Did you know taurine, when supplemented, may improve heart health? Taurine supplements have been shown to regulate blood pressure and improve heart function and blood fat levels in people with heart conditions such as heart failure. At high levels, it may even protect against heart disease. Ask your doctor if taurine supplements are right for you. People with heart failure took 500 milligrams of taurine 3 times a day for 2 weeks. What did they find? A significant reduction in levels of total cholesterol, lowered triglycerides, and lowered C-reactive protein levels, which is a blood marker for inflammation and heart attacks, both before and after exercise compared to those who took a placebo. In a 12-week study with people with high normal blood pressure, taking 1.6 grams of taurine per day reduced overall high blood pressure numbers of systolic and diastolic numbers compared with a placebo. Taurine supplements may help reduce high blood pressure by decreasing the resistance of blood flow in your blood vessels walls and by improving the efficacy or efficiency of skeletal and heart muscle contractions. Anybody out there with high blood pressure, you might want to ask your medical doctor if taurine supplements are right for you. What are some of the other published health benefits of supplementing an amino acid found in nature in our food supply if you supplement it daily? That's published to possibly improve your eye health, improve hearing, may offer neuroprotective effects, and may support liver health. What about vitamin D? Well, science wants you to believe that the sun is bad for you. Well, all of life requires sunlight in order to thrive, but we've all been told that vitamin D levels are bad for you. Well, what's the good side of supplementing with vitamin D or making sure you're getting 20 minutes of sunshine every single day on the majority of your body? Did you know that vitamin D supplementation may fight diseases, including reducing your risk for multiple sclerosis? That is published in medical journals. Did you know vitamin D deficiency? If you take supplemented vitamin D, it may decrease the chance for heart disease. That low vitamin D levels have been linked to increased risk of heart diseases such as hypertension, heart failure, and strokes. Did you know that vitamin D supplementing can reduce the likelihood of severe illnesses? Healthline also reports that it supports your immune health. And people who do not have adequate vitamin D levels, they report, have an increased risk of infections and autoimmune diseases, such as rheumatoid arthritis, type 1 diabetes, and IBS, or inflammatory bowel diseases. Did you know that supplementing with vitamin D may support weight loss? In an older study, they said people taking daily calcium and vitamin D supplements lost more weight than subjects taking a placebo. The researchers suggest that the extra calcium in vitamin D may have an appetite-suppressing effect. This is one of the studies that's being highlighted by researchers at Healthline.com or journalists there about the actual health benefits and immune benefits of vitamin C. This actual 2020 study is titled Vitamin C, an Additional Therapy for Respiratory Infections, Sepsis, and COVID-19. The vitamin C deficiency disease, scurvy, has long been associated with pneumonia, which led to the view that vitamin C may influence susceptibility to respiratory infections. People deficient in vitamin C may be more susceptible to severe respiratory infections such as pneumonia. A study of 19,000 men and women followed for over 20 years. They found that people in the top individuals with higher amounts of vitamin C in their blood had a 30% lower risk of developing pneumonia. This specific trial in the UK they're referencing here was 168 volunteers who were randomly assigned to receive either a placebo or vitamin C for 60 days during the winter. The vitamin C group had fewer colds and even fewer virally challenged cold days, and a shorter duration of severe symptom days. The number of participants who had 2 colds during the trial was significantly reduced in the vitamin C group. You can see the numbers there. And remember, if I don't go and touch on and don't have time to review every highlighted statement from these research studies, go to my website, thedrardisshow.com, go to the resources tab. This PowerPoint of essential nutrients, vitamins you need, is highlighted in a blue box. Click it. You can download the entire PowerPoint for free for your review and research, or wanting to send it to someone via email or text. You can do the same thing. This is the clinical evidence for the role of vitamin C in pneumonia. And I have to speak to this. There are millions of Americans, particularly the elderly, who experience chronic reoccurring pneumonia every year. For those of you who have hip fractures or breaks, what are you told? The number one risk factor for your death is actually going into a hospital for surgery of your broken hip or hip replacement surgery and developing pneumonia while you're in there. So the pneumonia takes the lives of these people, not necessarily the fractures. This is the clinical evidence for the role of vitamin C in pneumonia. A Cochrane review on pneumonia and vitamin C identified 3 randomized clinical trials reporting the number of pneumonia cases in participants who were administered oral vitamin C. Each of these 3 trials found an 80% lower incidence of pneumonia for the vitamin C groups. One was a randomized clinical trial giving 2 grams of vitamin C a day versus the placebo to U.S. Marine recruits during a 2-month recruiting training period, and they reported that only 1 in 331 cases of pneumonia in the vitamin C group versus 7 out of 343 in the other group. The duration of hospital stays in the control group was 23 days with pneumonia. In the low-dose vitamin C group, hospital stay was 19% shorter. If they had a low-dose vitamin C given to them, the hospital stay was reduced by 19%. Then in the high-dose group was even lower at a 36% shorter stay in the hospital. The low-dose vitamin C group, they left 19% faster. Those in the higher dose group, they left 36% faster from the hospital. Let's look at this study from Springer Nature, titled, 2021 is the date, Vitamin C for Sepsis Intervention. What did they find? The trial did show a potential benefit of vitamin C therapy in reducing the death. At day 28, mortality was reduced by 46% in the placebo group versus 29% in the vitamin C group. So 46% of people died that were not given vitamin C, and only 29% of them died that were given vitamin C. This significant reduction in mortality was in the vitamin C therapy group. This preliminary finding in sepsis patients is also consistent with the well-demonstrated effectiveness of vitamin C in treating experimental sepsis in animal models. Apparently, the efficacy of high-dose vitamin C therapy in patients with sepsis and acute respiratory distress syndrome, yeah, it reads like Ardis, warrants further randomized clinical trials to focus on mortality reduction and long-term survival. What about the association between blood vitamin C and your blood pressure? Here is one example. Remember, if you want to review all of the statements we highlight in here, the PowerPoint is free to download at the Resources tab at the Dr. Ardis Show. Vitamin C level concentrations in your blood. The level of blood vitamin C between hypertensive, high blood pressure subjects and those with normal blood pressure, I want to highlight, they found that the blood level of vitamin C in the high blood pressure group was 15 micromoles lower per liter than in the normal blood pressure group. So they saw those with high blood pressure had lower vitamin C levels in their blood. And that correlated to their systolic blood pressure being higher. The correlation between blood vitamin C levels and systolic blood pressures was described in over 12 studies. What they found was a reverse relationship between vitamin C concentration and systolic blood pressure was significant. So the higher the vitamin C level, the lower their systolic blood pressure. The lower their vitamin C went, the higher their systolic blood pressure went. Those of you with high blood pressure diagnoses, you might want to ask your medical professional if vitamin C supplemented is right for you. When it came to diastolic blood pressure, the low number on your blood pressure reading, they also found the exact same thing. There was an inverse correlation to the vitamin C levels. The lower the vitamin C level, the higher their diastolic blood pressure. The higher their vitamin C levels, the lower or more normal their blood pressure was for all ages. Now let's look at a research study from Therapeutic Advanced Cardiovascular Journal, dated 2017. Taurine supplementation has an anti-atherogenic and anti-inflammatory effect before and after incremental exercise in heart failure patients. So this is the atherogenic indices. This is where they're talking about the hardening of the arteries, the plaquing of the arteries. They saw a significantly decrease in pre-exercise, post-supplementation, and post-exercise group as compared with the post-exercise, pre-supplemented group in the Torine group. They saw their atherogenic scales, hardening, plaquing of their arteries, was lower in the Taurine group after exercise for those with heart failure. When you look at triglycerides, which they measure with what's called the AC index, there was a significant time effect for the AC index in the Taurine group. They saw that Taurine reduced triglycerides in the pre-exercise, post-supplemented, and post-exercise groups as compared to those with the placebo. So those worried about atherosclerosis, you might want to ask if taurine supplemented is right for you. It's already been proven in research studies. What about the most common inflammatory marker found in people who just had a heart attack? It's called CRP, C-reactive protein. They found there was also a significant reduction in CRP levels in people when supplementing with taurine compared to those who don't after being diagnosed with heart failure. Ask your cardiologist if supplementing with taurine is right for you. It should be. This present study, the researchers concluded, indicates that 2 weeks of oral taurine supplementation is able to ease decreasing atherogenic scales and inflammatory indices in heart failure patients. This study provides evidence that taurine may offer a relatively inexpensive agent to treat some forms of cardiovascular disease, especially when prescribed alongside exercise. I cannot reiterate, taurine should be considered by all to improve your cardiovascular risk. And if you've never read the book, Toxic Legacy by Dr. Stephanie Seneff from MIT, she highlights why it is taurine in our bodies is under assault. Also in our farms by an herbicide called glyphosate. It's at toxic levels, she reports, in 90% of all farmland in America. It's in our vegetables, it's in our plants that we eat, and it destroys, glyphosate does, our taurine levels, which are required for optimum health, which is why I ever released the supplement taurine on our website. From a toxicology report in 2016, they have a research study titled The Effect of Taurine on Chronic and Acute Liver Injuries, a focus on blood and brain ammonia. Acetaminophen, a very common pain reliever. Acetaminophen is a commonly used drug which can produce hepatic damage or liver damage. A high dose of acetaminophen was administered to mice, and liver injury was assessed 24 hours later after drug administration of acetaminophen. That was administered 2 hours after acetaminophen was TA, that stands for taurine administration. Control animals received acetaminophen solvent, and a group of mice received the taurine alone. What's acetaminophen? Tylenol. What they found was a significant increase in the activities of plasma enzyme levels that you would see on your blood report, ALT, LDH, AST, and ALP, plasma total bilirubin, liver lipid peroxidation, and a decrease in liver glutathione content were detected in those who received Tylenol, acetaminophen. It was found that taurine administration of 500 to 1,000 milligrams a day significantly alleviated or reversed the disease changes in the blood and the liver biochemistry in all investigated acute and chronic models of liver injury. If you know somebody with liver toxicity, you might want to ask them to ask their medical professional if taurine supplemented would be right for them, even if they're on specific non-steroidal anti-inflammatory drugs like Tylenol. Underneath the section of this NIH study, which you can read on your own, we have the link below, they wanted to look at the effect of taurine on brain edema, plasma, your blood, and brain ammonia in animals' movements after acute and chronic liver injury. It was found that taurine administration effectively mitigated or reversed brain swelling and edema in these animals. They also saw a significant elevation in plasma ammonia, which is a negative, in those given the drug. And they found that in all investigated liver injury models. The elevation in plasma ammonia was accompanied with an increase in brain ammonia levels and a decrease in the total locomotor activity of animals. As the ammonia levels in the brain went up after using the drug called acetaminophen or Tylenol, when they saw the ammonia levels increase from the liver, it went to their brain and it reduced the movement, the locomotor action of their bodies, the control of their legs and arms and face. This negative correlation means that as blood levels of ammonia increases, animals' locomotor activity tends to drop. Blood and brain ammonia levels were significantly lower in the taurine-treated groups. Furthermore, taurine administration of 500 to 1,000 milligrams improved animals' movements in the open field test. Their conclusion, the current investigation focuses on the role of taurine administration on the blood and brain ammonia levels. Well, how many of you are on drugs or being prescribed drugs and you know they are checking you regularly, your liver enzyme levels, to see what liver toxicity is coming from the drugs they're prescribing? You need to ask your medical professionals as they review every 6 months to a year your liver levels. You might want to ask them as those start being elevated. Ask them if taurine might be right for you because of these types of studies. Our data indicates that taurine might be a useful agent to preserve liver function and prevent rise in blood and brain ammonia as a deleterious consequence of acute and chronic liver injury. Hence, taurine supplementation might be considered as a therapeutic approach to ameliorate the severity of hepatic or liver impairment and fibrosis, in addition of brain damage and neurological disorders in acute and chronic cases of liver injury in humans. Now we're going to highlight vitamin D supplementation. This is from a study in 2020. Evidence that vitamin D supplementation could reduce the risk of influenza and COVID-19 infections and deaths. Ecological studies suggest that rising vitamin D concentrations through vitamin D supplementation in winter would reduce the risk of developing the flu. Not flu shots. Vitamin D alone can reduce the risk of developing flu-like symptoms. The role of vitamin D in the flu was published in 2018. It concluded that the evidence of vitamin D's effects on the immune system suggests that vitamin D should reduce the risk of influenza in humans. A clinical trial involving postmenopausal women living on Long Island, New York, with an average baseline concentration of vitamin D at 19, found that when they supplemented with 2,000 international units, it resulted in significantly fewer upper respiratory tract infections, including the flu, than the placebo group or those supplemented with only 800 international units of vitamin D compared to the 2,000 IUs. They found that a high-dose vitamin D trial in ventilated ICU patients in Georgia, those that are intubated, can't breathe on their own, they're on machines, they found in these people in hospitals in Georgia, they had an average vitamin D level of 20 to 22 nanograms per milliliter of blood. Reported that hospital length of stay was reduced from 36 days on average in the control group to only 25 days in the group given 250,000 international units of vitamin D. And then that same time frame was reduced from 36 days down to 18 days in the group given 500,000 international units of vitamin D in a hospital. So if you or a loved one is in a hospital with pneumonia or the flu, remember, when you say, will you please give my loved one vitamin C and vitamin D, and they say to you, but there's no research proving it, please download this PowerPoint, please look up this research study, print out this PowerPoint or you want, or print out this actual research study, underline these statements and give it to your medical doctor. And then they know the exact doses to reduce your time spent in the hospital trying to recover from pneumonia or the flu. Vitamin D's effect on the immune system. Did you know that vitamin D as a whole has an important effect on macrophages, your white blood cells that eat infections and cancer cells? And tremendous efforts has been put into linking vitamin D to TB. It has been demonstrated that vitamin D deficiency increases the risk of developing active tuberculosis. Furthermore, adding vitamin D supplementation to anti-tuberculosis treatment has been shown to have a beneficial effect. Anybody with TB? Make sure you give your loved ones vitamin D. What about those with chronic obstructive pulmonary disease, COPD? Did you know it's been demonstrated that patients with COPD were more likely to suffer from vitamin D deficiency than matched healthy smokers with a deterioration of COPD classification and exacerbation rate associated with a further decrease in vitamin D levels? Did you know restoring vitamin D deficiency reduces incidences of exacerbations of COPD? Did you know in autoimmune diseases, there's a clear association between vitamin D deficiency and the incidence of autoimmune diseases? How about type 1 diabetes, multiple sclerosis, rheumatoid arthritis, systemic sclerosis, systemic lupus, and inflammatory bowel disorders, that the circulating levels of vitamin D, independent of seasonal variation in latitude, are decreased at disease onset of all of those diseases when you're diagnosed as during follow-ups. All of those conditions combined and individually, everybody diagnosed with those, all of those on the list, on the screen, they have low levels of circulating vitamin D in their blood. A review of 5,900 subjects in various research studies demonstrate that in both multiple sclerosis and in type 1 diabetes, as principal examples of immune-mediated diseases, there was a lower level of vitamin D in the affected patients than in the healthy control groups. In lupus patients, lower levels of vitamin D were even associated with an increased frequency of lupus flares. Oh my God, has your rheumatologist told any of you or your loved ones struggling with these conditions that it's already been proven in studies that if you start supplementing with vitamin D, you will see lower reactions of flares or symptoms related to MS, diabetics, and lupus? Ask your rheumatologist if vitamin D supplementation is right for you. This is our vitamin C supplement at Nature Wins thedrardisshow.com. This is our Immune C. You will see that 3 capsules contain 1,000 milligrams of ascorbic acid, otherwise known as vitamin C. Ask your doctor if nature wins, Immune C would be right for you. This is our 500 milligrams a day, 1 capsule taurine amino acid supplement. And as we showed you the highlighted benefits of taurine being supplemented, the reference range was always 500 milligrams up to 1,000 milligrams in human studies. So all of you watching, if you're considering taking taurine to improve your health outcomes, you can take 1 capsule of our taurine that has 500 milligrams. If you want to take the upper amount you saw in the research studies, you would simply take 2 capsules a day and you would see even added benefits faster. What about vitamin D3? This is our vitamin D3 supplement. It has 5,000 IUs per capsule. I recommend typically anybody doing 5,000 IUs up to 10,000 IUs a day, which would be 2 capsules, particularly in the winter months. But everybody should be getting a minimum. I recommend 5,000 IUs of vitamin D3 every single day. When it comes to our Doc's Healthy Kids Daily Chewable Supplement, I had to include both vitamin C and vitamin D in the formula, as you see highlighted, to try to boost the immune systems of all of our children, keep their cardiovascular system healthy, and their neurological systems developing on time adequately. So ask your pediatrician, or if you like just natural products made with all natural flavoring and sweeteners, in a delicious berry-flavored chewable tablet that I personally formulated, Doc's Healthy Kids Daily Chewable may be right for you. But I will warn you, if you're giving that to your kids, you might want to try one because you might get hooked too. They're delicious, all natural, multivitamin. This is our new book, and a reminder, make sure everybody you know and love, or any health professionals trying to help people around the world with their long COVID symptoms or making sense of their COVID-19 vaccine injuries. That's why we wrote the best-selling book, Moving Beyond COVID-19 Lies, Restoring Health and Hope for Humanity. And you can find that at thedrardisshow.com. Remember, if you enjoyed this presentation, you want to be notified when our next one's coming out next week, please scan the QR code, put in your email address, and you will be notified every time we come out with a new presentation, a speaking engagement, where we are going to be helping, educating, and restoring your faith in the healing potential of nature. I'm Dr. Ardis. This is the Dr. Ardis Show. We will see you next time.